Hello everyone, welcome to our new show. My name is Jason, this is Don, and you may know me as Hitman82 on this channel. So Don has some words for you.
Thanks, Jason. One of the first videos we wanted to make was regarding a medical kit for the family. A good question somebody might want to ask us is why would we invest $400 Canadian dollars, that is, into medical kits? And when you look at our situation, we live on a small island. When we have storms here, trees come down. Sometimes it takes up to 2 weeks to clear the roads for medical vehicles or fire trucks where they get through. And we use a lot of heavy equipment around here, a lot of chainsaw work, a lot of backhoe work, that sort of thing. So we have, you know, risks, and when we looked at those risks, we decided we would make sure that something happens here, we can respond ourselves fairly quickly. So that's why we decided to do the video on the medical kit. So I think that's about it.
Yeah, let's get started.
Right. Okay guys, here's our total medical kit. As you can see, we've broken it into two bags. The red bag, and that's the one we're going to talk about here in part 1, and the black bag we'll cover in part 2. The black bag contains some other things that we have at home, such as symptom relief, that sort of thing. The red bag is the bag that we take in the vehicle if we go on a day trip, so it's a lot lighter and easier to handle. So let's have a go at what we have in the. Thanks, Jason. What we have in our red bag. A couple of things right off the bat. We have a face shield, so that if you're helping somebody, you can kind of protect yourself as well. We have a whistle for alerting people, signaling device.
Traffic and stuff.
Yeah. One of the things right off the bat we also have is a headlamp, and again that's for being able to do hands-free operation.
Now we're looking to get a smaller light that fits in the bag a little better.
Okay, this red bag is broken down into 2 or 3 sections. So the first one that we're going to look at what we've got in here. One of the first things that you're going to come across is our PPE bag.
PPE means?
And PPE is personal protective equipment. So in here we have what do we got? We've got a couple of masks, again to protect you or the person that you're helping. We have a couple of sets of the nitrile gloves to prevent infection between 2 different people. We've got a bag here called a dressing disposal bag, just should you need it. We have a CPR breathing barrier, again to protect you when you're trying to help somebody else. And we have a little emergency blanket, just a crappy little thing that we thought we would put in there. These are very useful for if somebody happens to be in shock, especially at a car accident or something like that. They retain something like 80–90% of the body heat, and you can put this over them in case of inclement weather. Okay, let's see what else we've got in here. Okay, one thing right off the bat we have is this is just a little buck light, kind of a utility type tool, handy for all kinds of things. In it as well we have a blade. This will shave the hair off your arm, no problem. All kinds of little gadgets there, so that could be pretty useful. We have EMT shears, especially for cutting clothing, something like that.
Show this a little closer here.
Yeah, well, they're pretty standard, yeah, so they don't hook you there when you're cutting. In here we have a pen light. Again, if it's dark and you want a closer inspection of a wound, you can use something like this, shine a bit of light on it. Also good for checking pupil dilation and that sort of thing for possible concussions. We have a little booklet there we have. Again, it's called Write in the Rain, so it's good for if you have to make notes of some sort. A little first aid booklet. A Sharpie permanent marker if you have to mark on a tourniquet or somebody's forehead if you put a tourniquet on it. And of course, when all else fails, a good old-fashioned carpenter pencil. Some of the other tools we have in the trauma kit. Let's see what we've got. We have some wooden sticks that could be used as either a tongue depressor or as a kind of a splint if you need to make one. We have an interesting thing, kind of using this particular device as a irrigation syringe. If you put some saline solution or distilled water, something like that in here, you can use that to cleanse a wound. We have a couple of different sets of tweezers for splinter removal. We have a thermometer, just a standard oral thermometer. We also have a couple of Thermo-sticks. Basically, you put that in somebody's mouth and leave it there. I can't remember, 20 seconds, something like that, and pull it out, and you can read the temperature. Again, if you've got a couple of people you want to check, something like that's pretty handy. Got a hemostat. Again, if you need to do any kind of a clamping, that's the device to use. We have also surgical scissors. Again, they're good for cutting bandages off, or for a bit finer operation than the EMT shears. We have some sort of Q-tip type thing for swabbing out a wound or something like that. Got a couple of safety pins, and we have a disposable razor that if if you have to cut any hair away or something like that, a lot safer on the person than, of course, me using a knife.
Yeah, multi-tool, yeah, that'd be a little rough.
Okay, what else do we have in here? So our trauma kit, we've got three sort of sections. One is wound care and burns, another is fracture and sprains, and then we have one that kind of supports the other two. There's some antiseptic type stuff. We'll get into that. So first, let's have a look at the old fractures and sprains.
It's handy to have this as a Costco bag and from an old kit that we got.
Yeah, we bought that a few years ago. I think we paid about 30 bucks, but of course we put a lot better stuff in it, so that it's now good for us. Right off the bat, actually it's more probably for wounds, but this is the only space I could put it. It's a tourniquet called a soft T tourniquet. It's a wide version. Again, one of the most important, I think, things to carry in a trauma type kit. However, you really got to practice using this before you need it, because when you're in a panic situation, if you don't automatically know how to use these things, you could waste a lot of valuable time trying to figure it out. So that's something we're definitely going to be practicing.
See the stick along there? That's for torquing it down.
Torquing her down, yeah.
And the label to write down what time you put it on for
exactly.
The emergency people show up, they know when it went on.
Exactly. We have a couple of triangle bandages. They're used for everything from making an arm sling to if you need to do any splinting, you can use that to help secure it. Your old standard tensor bandage, elastic tensor bandage. Some people call them ace bandages. We've got some more sterile elastic bandage for wrapping any kind of a sprain or something like that. We have a finger splint, which Jason's quite familiar with. He's gotten to be very friendly with that for a month or so.
Sprain finger, not fun.
We've also got what's called a SAM splint. Basically a cushioned aluminum thing that can be molded into any kind of shape that you want. I think they're pretty darn handy to have. You can cut these things to whatever size you need with an EMT shears. They're also x-ray friendly, so if you go to the hospital, they don't have to start trying to take all this stuff off to check if you've got a fracture. They can x-ray right through it, so they claim anyway. and they have a couple little pictures on the front of some applications. So pretty useful thing to have. I'll just put that back in there, Jason. Okay, on the other far side, we're into wounds and burns. One of the first things in there is a little eye wash setup that we have. The eye wash, I think that's 200 mils of saline solution and a little, I think there might be a bit of witch hazel in there as well. I taped the cap on because when I first pulled this thing out, the cap went flying all over the floor, and that's what you don't need when you're all panicky as it is trying to do an eye wash on somebody. So I taped the cap, make sure it stays there. And you can also use that for irrigation.
Yeah, that syringe.
Dip the syringe in there to fill that up if you have a particular wound or something. Another indispensable item is called, this particular one's called an Israeli bandage. You can look it up on YouTube. Again, it's basically a sterile pad that goes over a bleeding wound, and then elastic bandage that you can also get a tourniquet type effect on it. Very, very important, I think, to have in your kit.
Kind of hard to see in the lighting here. It's got instructions on it as well.
Okay. Blood stopper bandage, again another pad that you can wrap to try and put some pressure on a wound. We have a self-clinging type bandage. Again, what you do is when you wrap this around you and then somebody at the hospital goes to take it off, it won't pull all your hair and skin with you because it's sticking to itself.
You don't need those little metal clips either.
No, that's right. We also have this thing called Quick Clot. I think another big brand name is Celox. Anyway, what it is, it's a sponge that has impregnated with a clotting agent, so it'll clot you really quickly. If all else fails, this is a good thing to put on. There is some concern, long-term concerns over these things. You might want to have a check on YouTube. There's a couple of sites there that talk about some potential problems with that stuff, but if somebody is bleeding to death and you need to get the bleeding stopped quickly, this is the thing to use. Quick Clot. Okay, we have also a burn pad. Basically what this is a dressing that's sterile, and it has sort of a water and gel together in it. What it is it removes the heat off the burn. What I did learn was when you have a burn and you remove the heat source, you can still have continuing tissue damage. So if you put something like this on, it sucks the heat out right away and provides a sterile surface for you to till you get to the hospital and have somebody look at it. Okay. Okay. What else do we have here? In this pack we have a whole bunch of different kinds of bandages and pads, and I'm not going to go into every one of them. There's specialty ones, knuckles, knees, that sort of thing. A couple of maybe the more important ones too. A couple of eye pads here in case there's an injury. You can put a pad over it and then get some medical attention. We have the brown that you see in here is called Moleskin. If you got a pretty bad blister or something like that, you can use that to help protect it so you can get it healed up. Also, we've got some butterfly bandages. If you have a wound, cut or something, and you try to close it off, and before you can get some stitches or whatever, they could come in pretty handy. We have in here a whole selection of different types of sterile non-woven sponges, some non-stick type sponges. We have an abdominal pad in here, and again they tend to be a little thicker, so they absorb a little bit better. And also we've got a couple of spot burn type gel pads that you can put over. So again, kind of give you a bit of relief there until you can have further medical attention. Okay, so that's pretty well it in our, oh no, we got one more section, pardon me. Let's see what we've got in here. We have some more gauze type rolled bandages. Okay, we have a bit of duct tape in case you need it. We have some other types of tape, and most of it's waterproof type tape, just in case it's in the rain or whatever. We've got some antiseptic type ointment, you know, pretty common stuff, Polysporin, triple effect. We've got the BZK towelettes that are sort of an antiseptic type towelette. We've got a couple of alcohol wipes too, if you know, if you want to wipe the equipment off before you use it. So at least it's sort of half sterile when you get on somebody. We've got some petroleum jelly if you require it. These pink things I think are 10 or 15 mil irrigation type things for wound cleaning. You just snap the top off, give her a squeeze, help you clean out wounds. We have also a hand wash that the hospitals use. Again, pretty important, trying to keep yourself clean when you're trying to help somebody. We have some iodine, which you can use on a surface wound, or I believe you can even put a little bit on some of the water to help sterilize water. What we have here, one of the family has can have what's called a sport type asthma condition. If their strenuous activity can lead to sort of a little bit shortness of breath, we have one of these in here just in case it's required.
That would be me.
And we have a pain relief patch. What these are is, I think, sort of a menthol type pads, but anyway, you put them on and it kind of just a topical pain relief, so that you know, if you got pinched or burned, you know, finger caught in the car door or something like that, to put one of these things on might at least alleviate a bit of pain.
Yeah, it works pretty well. I tried one the other day.
Yeah. So that's kind of it in the in our sort of our go kit or automobile kit. And again, if we're going to go on a vacation, we would take this one plus the black one, so that we can handle most situations that arise. So the next video we are going to talk about the black one, and also at the end of that video we're going to show you a clipboard with a sheet on it that has a list of all the things that we have in the kit, so that can help you cherry pick what you might find useful to you. There's also some things on there like things that we considered putting in here and decided not to, things that we're still thinking about, but unfortunately our bags are getting fairly full there, so if we start trying to put too much more in, we either need a bigger bag or I'm going to have to take something out. So anyway, we'll get to that. We'll get to that in the next part 2 video. Okay, so thanks very much, guys.
Bye for now.
Okay.